Nelson Medical Practice is open 24 hours, easily accessible to the patients. So if they got any problem, they are more than welcome to be seen by a GP. There is always a resident GP here. Sometimes there are 2 or 3 clinicians working at a time to see the patients. And at out of hours, we do carry out home visits if the patient is housebound and elderly, and we do see patients at the base, and we do give telephone advice as well. So I think that's a big advantage that they have got such a nice building, and now it is used 24 hours.
Take a seat, Sarah, make yourself comfortable. How are you? The concept really frees doctors' time for more complex perhaps cases. It is solely for minor illnesses. And it also gives patients more choice and more opportunity to have that option, because there's more appointments free. So it's worth coming back, wasn't it, just to put your mind at rest? You know, you get a lot of services for the patient and at one sort of roof, so they don't have to travel a lot if need be. So now what we are doing is, we are planning this to become a training practice. So in that way, that will also meet the demands of our GP school, and will help our own GPs to advance.
It's a very positive move for the practice because we can integrate better with the community services. We have an excellent clinical team here with 4 GPs and 3 practice nurses and the administration team, all having their very own individual skills that support our patients.
My main role is to go into external workplaces to encourage them and promote health and wellbeing.
I've got an appointment with Kerry in occupational health.
So it can be anything from helping somebody to quit smoking and referring them to the stop smoking service, to weight management and encourage them to eat healthier, eat their 5 a day, and just maybe even eat breakfast or drink more water. Once you get in and you talk to them about what we can offer as an organisation, or the teams that we've got involved, they're actually quite keen to get involved, especially as the majority of it is free. A lot easier, which was great.
Basically, she does all our fact finding around many subjects, whatever we're looking at doing, gets us leaflets, posters, whatever the promotion is going to be. She does all that groundwork, and then if it's just a poster promotion, we stick it up in our canteens, or Abby and her team come in and do the actual promotion themselves.
There's so many resources out there that workplaces just don't know about. They just need telling. Ideas of how people can make themselves feel better, what they can do. When I was talking to Kerry, we were talking about National Stress Awareness Day. Actually, there's the National Stress Awareness Day website. So there's a complete website where you can go and get resources, and you can even refer your staff to go and look, because they have access to all sorts of health professionals that they can ask questions to. There's the British Heart Foundation website, posters as well that give the national. There's the Department of Health website, and they all have resources that are free, and you can order up to 200 booklets and leaflets and all sorts of things. So it's just raising awareness.
I think the fitness rating. When Abby first got involved with us, I took a presentation back to our board, and the unions have bought into the idea of these health promotions as well. BMI reduction is very good. If we're trying to push something, people always think, oh, there's an ulterior motive. But then if you've got the unions saying, actually, no, this is for you, it's not for the business. It's, yeah, okay, you might have better health, and you might stay at work, and you might not be off, but ultimately it's for you and your health.
When we do blood pressure checks, it can be anything from detecting whether somebody may be leading up to a heart attack, a stroke. You know, if they've got incredibly high blood pressure and you catch it early, it can actually reduce all those things from happening. But not only that, it reduces the cost to the NHS as a whole organisation. You know, we look at ourselves as a preventative service.
Marham Green's been open 2 years, and it's a unique, very sheltered housing scheme in the sense that we provide lots of other different services here. And it also comes with a gym. The hub's been open since August. We had
fantastic open day, lots of interest from the public, the general public, as well as our residents and their families and their friends. And it's been a huge success, it really is, and we are actually seeing the benefits to those people that have had strokes, that have dementia, and any other complaints that they have had.
Yeah, if only I could go a bit quicker.
I'm sure you can get an engine on it. Yeah. Okay.
We've basically came to this point where we realised that Kessingland was one of the areas that had high levels of deprivation and also high health issues which we needed to focus on. So putting the community hub in Marham Green seemed a logical solution. Working with Flagship and Jane, we've managed to secure the room rent-free for 5 years. So we've just simply put in some equipment that was supplied to us by Technogym, and we staff it with high-level instructors which work for us on a subcontracted basis. We're really looking to extend the gym into other activities as well, and these activities will actually be decided by the community and also the residents here. And we will just facilitate using the staff that we have around us to make this happen.
I would never have gone to a gym. I don't like the speed that everybody goes at, and you're in a room where it's all hot and sweaty, I should imagine. I've never fancied that at all. But here, you've got your own pace. It's not too strenuous. You don't feel you're going to hurt yourself. You can be as gentle or as strong as you like.
We really want the centre over the 5-year period to grow to be a community thing, really run for the community, run by the community. We're just merely there to add our expertise and sort of help that process. The overall aim is that we should be able to deliver up to 40 hours of exercise to Kessingland and the local area.
I'm actually the administration assistant, and I obviously do all the paperwork for the scheme. And one of the main reasons why I'm using the gym, not only because I'm a member of staff, is because I've actually got a health issue. I've got degenerative disc disease in my spine. I think it's marvellous, absolutely brilliant idea. We've waited a long time for this and it's really exciting.
It's just a social occasion, and we all have a laugh as well. That's the nice thing about it.
I've seen many times in many job roles I've had through exercise how physical activity can change someone's outlook to life. It helps to promote positive thought, makes people realise that they can do things that they never thought possible. And this transfers not only into physical activity but just also into their life and their own sort of goal setting and aspirations.
I haven't lost any weight yet, but I feel that it's toning me up a bit, and I'm not aching so much. It just makes you feel more supple, a bit more agile, and it helps with walking. It makes it all much easier.